Mr. Reed asked you some questions about the history of being bedridden, fever, and headaches for a week. I assume, first of all, you got that history from the parents, right?
Right.
You didn't review any records and glean that from the records.
I'm not sure the records were available, but I did speak to the parents.
So your assumptions as to the history from the parents, you just give them the benefit of the doubt and assume that that is a correct history.
Yes, when the patient wasn't able to tell me, yes, I relied on the family.
All right. Have you at any time before your deposition today been able to review the records of North Regional Medical Center?
I don't recall ever seeing records from North.
All right. Have you had a chance to meet with anyone in preparation for the depot other than your counsel?
I have not met with anyone.
What is your understanding of what the allegations in the lawsuit are?
I don't really know what the allegations in the lawsuit are.
Okay, that's fine. And you're not going to comment, just to kind of take it one step further from Mr. Reed's questions. You're not going to be offering any testimony concerning the standard of care of the physicians at North Regional Medical Center, where they evaluated and treated Joe Johnson on July 23rd.
I have no idea what they did.
All right. You told us when we started out that you had been called in on the case by the pediatric intensivists. Would that be Dr. Lowe? Was he one of those physicians?
His name is one that is one. I don't know exactly which one called me. The only reason I associate him with it is because his name is the one that is on the patient's sticker.
All right. Well, it looks like he was the one physician that was personally involved, at least in the beginning, but you don't have a recollection.
I don't recall specifically.
And just to clarify, I'm not sure that we did establish this. Your consult note, which I think was marked as an exhibit that said 724 on it, that is not correct, we know.
Yes.
Now, is it more likely, based on the other information in the chart, that it was actually 726? That was the first day you saw him?
725.
Joe came in through the emergency department in the evening of July 25th, so you would have seen him that evening.
Right.
Did you look at the CT film yourself, or did you just review the report?
That I don't recall specifically. I believe I looked at the film, but I don't recall that specifically.
Are you familiar with the disease process or the entity of cerebritis? Is that something that you're familiar with in your practice?
It's not something that I would be asked to look at.
You know what it is, though.
It's a brain swelling, I assume, just from I'm not familiar with the clinical entity of cerebritis.
All right. If you were to see it on film, would you recognize it?
No.
Do you know whether Joe Johnson had evidence on CT of cerebritis on July 25th?
It's not something that I would recognize on the films.
And aside from whether you could independently appreciate it yourself, do you recall being aware one way or the other that he had cerebritis?
You're not referring to a brain abscess, which...
No, I'm talking about inflammation of the cortex is what I understand it is.
I don't know.
All right. You told us in response to Mr. Reed's questions that when you first saw Joe on July 25th, that he had no history of sinus disease, and I wanted to ask you what that means.
The family told me that prior to this episode, he had not been diagnosed by his doctors with sinusitis.
Now, as far as sinusitis, would you just tell us generally what that is for the benefit of the people who are not physicians?
Well, there is obviously many different types of sinusitis. You can have blockage of the sinus cavity's drainage hole from swelling, whether it's from a cold or upper respiratory infection or allergy. The sinus is blocked, contents get trapped inside the sinus, and pressure can go up, causing a headache. There may or may not be infections associated with that.
Is there a classic clinical presentation that you, as an ENT, look at for when you're trying to evaluate a patient for sinusitis?
There is no one classic presentation.
Are there symptoms that are commonly seen in sinusitis?
There are a number of symptoms that can be seen.
All right. Well, what about nasal discharge? Do you typically see that with sinusitis?
You can in acute sinusitis. In chronic sinusitis, you very possibly won't.
Did Joe Johnson have acute or chronic sinusitis, in your opinion, if you have one?
Well, Joe was acutely ill at the time, so it would be an acute process.
So can we agree for the purposes of this discussion, we're dealing with acute sinusitis?
Most likely, yes.
Would you expect then that in evaluating a patient for acute sinusitis, that more likely than not, you're going to find nasal discharge?
You may or may not. You can easily have blockage of a sinus without having visible drainage, which when I examined him in that time with a telescope to get that initial culture, there was no active pus in his nose.
Okay, this will be some